Alrighty then, so welcome. Now let's talk health, and on health today we have Dr. Dira Onifade, the Chief Medical Officer at Doktorconnect, a health tech company on a mission to making quality healthcare deliverable to everybody via your mobile phone. Now he's going to be shedding some light on something salient today, talking about the importance of regular medical checks is what he's going to be doing. Now, you're welcome, Dr. Dira.
Thank you.
Good to have you here today. Fantastic. Now, today's topic is very, very interesting for me because, I mean, the importance of regular medical checks, this is something that not everybody actually does. We know we should do it, but we are often very either lackadaisical about it or just like, I don't want to find out all those things because it's always sometimes bad news.
Sure.
But how important is it for people to actually get regular medical checks?
Okay. The importance of regular medical checks cannot be overemphasized. It's really very important, and unfortunately, most people are doing it wrongly, even those that are doing it. Because we don't want to call it yearly checks like what people call it. We call it health assessment. Because if you call it regular medical checks like what everybody call it, you do it in a way that you are not testing the right thing you should be testing. Why should I want to test what is not going to affect you? Why do I want to test what, even if I find out I'm not going to be able to do anything about it? So there are some parameters you need to look on when you want to do this health assessment for people. Like in some offices, they say they want to do executive checks for maybe their VIP staff and all that. So, but what we do is that there are three factors we look at. One, what is the cost of this to the patient? Are we going to be able to alter the course of this disease if we discover anything? Then we look at if this thing is not going to affect the quality of your life, then why go for it? Yeah. So that's what we've been able to do with Doktorconnect. And when you come to us, we just don't say this thing is very important for you to do, but why is it important? And if we detect it, can we alter the course of this thing?
Okay, so two things. Let's start with cost. Now, how expensive or how affordable is it to go for regular checks? The average man now, how affordable is it?
Okay. How affordable it is depends on what exactly are we checking. For example, someone that has a high risk of hypertension, diabetes, and probably stroke and other cardiovascular disease in his family. That kind of person, you want to look into the details of all those things rather than just say, okay, come, do your full blood count, do ECG, do all that. So the cost is relative. It depends on what are we looking for. So, but the technology now, the cost is now so cheap because where you are supposed to be spending like maybe 100K, you're probably spending like 30,000 naira, thereabouts. Because now you
this
use
is per
data.
Year, or is this?
Per year, yes. Per now we use data. We look like, okay, what has data told us about you? Not what do we feel about you? And that is the good thing when you have data with your fingertips. So you look at this person that, what are the data giving you, and you go for it. So it's really very cheap when we do that. Okay.
Now you're also a tech. Well, you've put a bit of tech into the health thing, so it's
because that's what we do.
Exactly. Especially now that everything we actually do is, centered around our ability to access information via our phones and all of that. But I have a question regarding lifestyle and these regular checks. Some of these ailments that we find out that we get, especially in latter years, are due to habits that we had when we were younger. Does that make it for a person who has identified that I have so and so, how do you prepare for such an instance for that individual now after going for a check and finding out that you have something that, let me call them a lifestyle disease? How do you prepare for something like that?
Yes, it's simple because there's something we call genealogy in medicine. Genealogy is like a family tree. Yeah. So when we take history of the patient, we know that, okay, your dad has this, your mom has this. We trace it down, we see that, okay, these are the things that is peculiar to your family. Then we now start advising you that, okay, you need to modify this. Maybe you smoke, stop smoking. You drink, maybe you reduce your drinking to a particular quantity that is safe for you. Note the two words, smoking, you stop. We don't say reduce. Okay. That's one thing that people say, okay, I've reduced my smoking, it's not as bad as before again.
Just stop.
No, stop. You stop it. Then reduce alcohol, then exercise. We don't get this exercise thing, and to me it is the most important thing apart from your diet. You need to exercise, even if it's just 30 minutes a day. So
do you exercise 30 minutes a day as a doctor and all your heavy schedule?
I do. Most times, if I don't do it in the morning, I do it in the night. I just walk on my street.
So just walk. You
Yes.
don't need to do anything excessive. No
Yes,
dumbbell
just
lifting and
walk.
all of that. Just walk.
That's fine.
Okay. Well,
That's fine.
Now, that is very interesting. Now, regarding alcohol, how much is too much?
How much is too much
I
depends
see
on
you
what
breathed
have.
there for a minute.
Yes, like some
Are
people
you a
say
drinking
12
man yourself?
Yeah, I take wine at times.
Wine,
Yes,
okay.
I take wine at times. But you know the way we drink in Nigeria?
Yeah.
Someone wants to take red wine and will finish like 1 or 2 bottles.
That's too much?
It's too much because you have to take this in with maybe a glass cup. You have they say 12 to 14 ounce. You measure that, convert it to our own calculation. So it's not to be the way we consume it. Someone will go and take like black label and take like 1 bottle, 2. Someone will take like White Walker and finish it at 6. So these things are quite so bad. You don't go that way. You just take like a glass cup, probably like 3 times a week. It's
3
fine.
times a week.
Because alcohol in itself has a degree of cardioprotection.
Okay.
Especially red wine, but not the way we consume it here in Nigeria.
Now, you're talking about red wine. That's very, yeah, very fancy. I'm talking about beer now, because that is the average man's, go-to after every day. I need a beer to like calm me down, that kind of thing. How much is too much of that?
Like we say, if you don't take more than 2 bottles, 3 bottles in a week, that's fine.
Okay.
But we know most people take 4 sitting
Some
down.
people do it every single day. They
And
end the day.
it's very bad.
So these are the lifestyle choices
that
that
increases
actually...
your cholesterol level. That makes you to be very prone to hypertension. That makes you to be prone to diabetes, obesity, and all these things follow. Hypertension, obesity, stroke, and these are the things that is killing our people.
Now, so I've gone for one of these regular checks. If I have identified that I have something maybe wrong with me, maybe liver or kidney, I don't know, and this was my lifestyle, what have I just bought myself into? How do I take care of myself from then on? How expensive does this become? What do I need to do? Well, you've already touched that part.
Yes.
But how does that change my life?
Prevention is very cheap.
So just don't walk into that.
Don't walk into that, because when you get to the intervention, there's something we normally say in our company. We call it the 3 Shons: nutrition, prevention, and intervention. The 3 Shons. So the cheapest part of that chain is prevention. Because even nutrition, most of us will not get it right.
Okay.
That's the truth. Because when you want to give you a diet regimen, don't eat this, don't eat, we can't comply to that.
So how can we make this accessible, these checks you're talking about? I know you're a tech person. You mentioned the accessibility on our phone. Can you touch on that real quick?
Okay, for you to get this, it's quite simple. We have an application that you can download, Doktorconnect. When you download it, we have 8 checks that you can quickly do per year, and you're good.
Okay.
And this thing can be as cheap as 40,000, 20,000, depending what exactly we see that is specific for you.
So it is absolutely necessary that we always get our yearly checks, and that's how we can access
impossible.
it.
It is very, very, very important.
Doktorconnect, make sure you download it, and then they can always reach you. And if you have any questions, do feel free. Make sure you reach out to us, and we'll have Dr. Dira here. Make sure that he gets a response to you in good time before you find out anything wrong with you. But don't worry, I'm sure you'll be fine. Thank you very much, Dr. Dira. We don't have too much time, but it's always a pleasure to have you on the show.
Thank you.